Professionals must communicate effectively with children in a wide variety of situations. They must ensure that any accounts of adverse experiences coming from children are accurate and as complete as possible. Inaccurate and/or incomplete accounts fail children who have experienced adversity. Exercise caution when considering expected developmental stage of children and the ages at which they occur. There is enormous variation between children. Memory is defined as the process of storing what is attended to and then being able to retrieve and use that information. Sensory memory is the briefest memory we have. Short-term memory allows us to hold information for about 30 seconds. Long-term memory is what usually coincides with the layman use of the word memory. Semantic memory concerns facts and those things we simply know about the world. It can be thought of as our internal reference library. Episodic memory is our memory for particular episodes and events that we have experienced. There are 3 memory stages: encoding, storage, and retrieval. What is encoded or registered varies between individuals and varies by age. The strength of memory that is stored varies according to what seems important to the person, the amount of exposure to the event, and prior knowledge about similar matters. Retrieval is influenced by the state of the child and their psychological and social circumstances. Memories that are more distant are especially prone to suggestion. The impact of stress on memory has been the subject of much debate. Stress does not necessarily negatively affect a child's memory. In some instances, a stressful event can make the memory more vivid. However, as the event becomes more negative and personally threatening, the child will focus more on how they feel and less on the details of the event. A series of psychological experiences have demonstrated that when children are asked questions about events they have experienced or witnessed, the type of question affects the accuracy of the child's answers. In regards to the consistency of children's recall over time, it has been shown that children and adults with genuine experiences do have inconsistencies within them. However, simple repetition and repeated recall are beneficial to maintaining information and memory over time. There are 3 types of consistency. Number 1, consistency of recall in response to repeated interviews. If children are questioned in an open-ended, non-leading way, their accounts in different interview sessions are likely to remain accurate. Number 2, consistency if questions are repeated within the same interview. Younger children especially, or those with a disability, may come to think that their first attempt to recall was inaccurate. Number 3, repeated events. Children who have been maltreated have often experienced repeated episodes of maltreatment. Therefore, the child memorizes many individual events and comes to recall what usually happens. Some general guidelines for practitioners: keep communication within the child's range of abilities. Be mindful of miscommunication or misunderstandings on your part or the child's. Free recall is preferable to specific questioning on the part of the practitioner. Children may not be able to discern the origin of their memory. Discourage general memories of the child. Promote accurate accounts from children with minimal suggestion. Invite free report. More than one session may allow the child to describe further details. The accuracy of the child's report will decrease if leading or suggestive techniques are used. The practitioner needs to use care when repeating questions to the child. Directive questioning may be needed for detail, but should be non-leading. Avoid leading questions. Do not pressure the child or be coercive. Maintain neutrality and take care with adult authority. Erroneous concern is not necessarily harmful, depending on how it is assessed and managed. There are 4 categories of concerns. These include substantiated concerns, those that are held to be cases of child abuse or neglect. Erroneous concerns by children. These arise from a child's mistaken concern or by children in conjunction with their parents. This also includes deliberate lies. Erroneous concern by adults. In this case, child maltreatment is considered to have not occurred because of either error by the referrer or professional. Inconclusive concerns. These are situations where there is uncertainty or insufficient clinical evidence to place the referred concern into any of the above categories. It has been suggested that there are at least 5 different reasons for children to lie: to avoid negative consequences, to protect their self-esteem, to maintain a relationship, to conform to norms and conventions, and to obtain a reward. Younger children tend to lie more often to avoid punishment. The impact of victimization affects 4 different dimensions of a child's life. These are appraisals of the victimization. Children at different developmental levels understand and appraise their experience of victimization differently. The impact of victimization on a child's current developmental status. Children at different stages of development are involved with different fundamental tasks, such as attachment, self-recognition, or peer relationships. Coping strategies. Children at different phases of development have different repertoires available to them with which to respond to stress. Environmental factors. Include the immediate family and wider social context surrounding children when they are victimized. Victimization experiences can lead to psychological impairment and problems in childhood, such as affective symptoms, fear, post-traumatic stress disorder, depression, behavior problems, conduct disorder, sexualized behavior, hyperactivity, and self-destructiveness, cognitive functioning, educational problems and language difficulties, personality and social adjustment, self-esteem, attachment, peer relations. The possible side effects of domestic violence upon children include increased symptoms of anxiety, post-traumatic stress disorder, conduct and behavior problems, hyperactivity, education problems, self-blame, and low self-esteem. The overall implication from these studies is that children who are victimized may be significantly affected in their development, adjustment, and psychological functioning. Some special problems occur when children have been threatened, manipulated, or bribed to maintain loyalties or secrets. Another problem is for children with severe symptoms of post-traumatic stress disorder. These children can find the recall process traumatic in itself and seek to avoid painful memories. In addition, those children who have come to blame themselves for the victimization can be hard to communicate with. A small group of children have victimized others. For these children, the experience of victimization is accompanied by its perpetration. Children with behavior problems. These are frequently demonstrated through excessive aggressiveness, hostility, or oppositional behavior. Implications for practitioners. Most children with behavior problems will not need special arrangements for assessment. Sometimes the presence of a support person is useful and occasionally necessary. Those with behavior problems may benefit from greater explanation of the rationale of the assessment. Children should be as involved as possible in the determination of where and how the assessment will take place. The gender of the practitioner should be considered. With severely behaviorally disturbed children, the practitioner should avoid overt confrontation, but be gently firm. Some children are attention-seeking and distractible. The best approach is to avoid anything that is attention-seeking and respond positively and with interest to positive behavior. Hyperactive children. The activity level of children can be increased for a number of reasons, including anxiety, fearfulness, or as a part of general behavioral difficulties. Implications for practitioners. Remember that even though most intelligence levels of hyperactive children are average, some may have language problems or trouble understanding. Aim for a calm, focused session. It is preferable not to spend too much time in unfocused periods or in unstructured breaks. Avoid having too many distractions. Consider whether to use the help of a professional. Keep the session relatively short. Choose moments to slow the pace of the interview. Maintain eye contact with the child. Hyperactive children. The activity level of children can increase for a number of reasons, including anxiety, fearfulness, or as a part of general behavioral difficulties. Implications for practitioners. Remember that even though most intelligent levels of hyperactive children are average, some may have language problems or trouble understanding. Aim for a calm, focused session. It is preferable not to spend too much time in unfocused periods or unstructured breaks. Avoid having too many distractions. The support of a person the child knows can be helpful to help the child focus. Consider whether to use the help of a professional. Keep the session relatively short. Some children with ADHD have accompanying behavioral problems. Choose moments to slow the pace of the interview. Maintain eye contact. Emotionally disturbed children. Children can become emotionally disturbed in a wide variety of ways, especially if they have been victimized. Common problems are excessive anxiety, tearfulness, post-traumatic stress disorder, depression, and dissociation. Some children suffering from fearfulness or anxiety are difficult to form rapport with. Implications for practitioners. It is preferable to know as much as possible about the child's psychological condition before an assessment is made. Be gentle yet clear about the rationale for the assessment. Direct eye contact for emotionally disturbed children can be difficult. Go at the child's pace. The rapport gaining may take longer with these children. Reluctant or uncommunicative children. Children may be reluctant to engage or participate in an assessment for many reasons. Some such children will have significant emotional difficulties. Others will have been coerced, bribed, etc., to not communicate. Some may not be reluctant to communicate, but rather have nothing to say, such as the situation has arisen in error. The central issue for the practitioner is to contemplate a broad variety of possible reasons why the child may be apparently uncommunicative. Implications for practitioners. Attempt to understand why the child might be reluctant to speak. Plan for additional time to gain rapport. Try to deal with impediments or obstacles, like the child's concern for confidentiality. Maintaining a non-judgmental approach is essential. Sometimes it is necessary to be persistent. Know as much as possible about the child and the child's family. Be aware of your own communication style. Difference and diversity. Implications for practice. Difference may result in children and their families being the subject of discrimination, and for some this may be compounded as a result of their particular circumstance. Difference should be addressed by the professional at an early stage in order to ensure that the child is worked with in a respectful manner. The cultural background of the participants is a key aspect to the context within which the interviewer and interviewee communicate. There has been very little research done on the interview with children from different racial or cultural groups from the practitioner. Disabled children. Children who have impairments that affect their communication may present difficult for practitioners. Accounts from disabled children who have poor communication may seem less convincing. However, children with some degree of disability are more often vulnerable to victimization. The term disabled children refers to a wide range of impairments. Disabled children are at greater risk than non-disabled children for maltreatment. Many practitioners experience greater difficulties when communicating with disabled children, especially those practitioners who do not have experience working with such children. A variety of systems of communication other than sign language and speech are used with some disabled children. Augmentative communication includes any system or tool that either supplements or replaces traditional communication methods. It is necessary to assess whether the child has sufficient cognitive ability to respond to questions about possible maltreatment. This may not be immediately clear if the augmentative communication system does not contain a sufficient range of language to enable the child to convey victimization experiences. Consequences of a child's impairment that present challenges for practitioners. Interviewers communicating with disabled children require awareness of the total situation of the disabled child, including experiences, attitudes, and expectations of helping professionals. The principles guiding practice for in-depth interviews should hold good for disabled children. It is the application that needs to be adapted. Some of the challenges present for practitioners are lack of familiarity with disabilities, low expectation, prejudice, or stereotypes, the disabled child's expectations of adults, lack of appreciation of the disabled child's identity. The quality of early communications is vitally important for a number of interrelated reasons. They are important from the child's perspective, especially if the child is harboring a secret. The success of the initial communication will act as a foundation for future intervention. When children have been victimized through sexual abuse, they are the main witnesses, and there are unlikely to be other sources of information readily forthcoming. Once a child's account has been distorted by poor communication, it is very difficult to retrieve the original memory of events. The skills and qualities possessed by the professional are interdependent. The professional will require all the skills and qualities listed in order to communicate effectively with children. 1. The capacity to listen. Listening is a quality that pervades all others discussed. Effective listening involves the combination of timing, interest, attending to the child, and being prepared to absorb what is communicated. Effective listening is underpinned by openness, open-mindedness, and an absence of bias. 2. Genuine interest. Curiosity in the individual child and their world. It is a prerequisite for effective communication with the child. 3. Empathy. The ability to identify and understand the child's thoughts and feelings. Empathy should convey both understanding and emotional sensitivity on the part of the professional. 4. Understanding. The child will need to feel that something important about him or her has been underscored by someone who cares and is willing and perhaps able to help. 5. Emotional warmth. This does not have to be excessive and probably should not be, especially if a child has been abused. Too much warmth causes discomfort for some. 6. Respect. Respecting a child's personal differences is necessary. 7. The capacity to manage the assessment. Having this ability will allay the child's anxieties or concerns. 8. Personal awareness of the entire transaction. Actively develop skills as an interviewer. There are two principal types of bias that are of importance to this field. Expectancy, which involves the practitioner placing greater weight and importance on things that the child communicates that fits with the practitioner's expectations. And typecasting. This refers to the professional prematurely or mistakenly placing the child within a certain category of children, and this leads to the practitioner to presuppose that the particular child shares characteristics with a group in question. Bias may be conveyed to the child either verbally or non-verbally. Interviewer distress can often lead to the children deciding not to reveal information. Technique involves the use of techniques that are more likely to lead to accurate and complete accounts, while avoiding those that are more prone to errors of omission or commission. Some techniques are known to be potentially inaccurate, and in general should be avoided, such as leading or suggestive comments to the child, the making of evaluative comments, and calls upon the child to imagine or pretend in or to clarify facts. Selective attentiveness or change in interest level of the interviewer in response to different parts of the child's account. These are detected and understood by the child, and this can affect the accuracy of an account. There is a consensus to discourage selective reinforcement and the more overt practice of promising rewards in the future for disclosure now. The professional approach for communicating with children can be summarized in terms of those qualities more likely to lead to positive outcomes. These are listening and understanding the child, conveying genuine empathetic concern, adopting the perspective that the child is the expert, allowing free recall, maintaining self-management and neutrality, operating within a context of continuing professional development and critical review of the practice. Age and development will affect children's capacity to describe their experiences. Several aspects and combinations of developmental maturation are likely to be relevant of this, such as children's capacity to understand their world and their role within it, their capacity to understand the nature and meaning of the complexity of adult behaviors, their ability to realize that they are being subjected to acts that the majority of people would consider wrong, the degree of maturity in terms of language and communication, their memory abilities. Children under the age of 7 have difficulty understanding their own role in and responsibility for what happens to them. This sometimes leads to what has been described as egocentricity on the part of younger children, which may in turn lead them to feeling responsible for things that have been done to them. There is some suggestion that at least within the field of child sexual abuse, that the closer the relationship between the child and the abuser, the less likely the child is freely to describe the abusive experience. Social and emotional factors. The disclosing of noxious events may be inhibited by the child's sense of embarrassment, guilt, and fear. Embarrassment over genital touching had a greater inhibitory effect on children as they got older. Not all sexual abuse is accompanied by the induction of guilt or coercion or threats, but a substantial portion is. It appears that embarrassment may affect some children's capacity to disclose sexual or other forms of intimate abuse. It is likely that children who experience positive social support will have less fear about the negative consequences of disclosure.